Hey there, Claire Cantro here with Spread the Well. I wanted to talk in this video specifically about tendinitis, and I'll probably do a couple other videos in the November, No More November series that looks at bursitis and fasciitis and other, I guess, myofascial or musculoskeletal diagnoses with the term itis. And what that directly translates to is inflammation of. So tendinitis, inflammation of the tendon; bursitis, inflammation of the bursa. And that diagnosis alone does not truly give you the total picture of what's happening in the tissue, okay? So if I have, and I'll use for this video, I'll use the example of a patellar tendinitis, okay? So first off, I'd like to say that even though sometimes it feels like our tendinitis popped up out of the blue, I woke up one day with it, it was there, or maybe even like, maybe there's been kind of a slow transition to this pain and it's just gotten worse, but now it is just so intense. I will say that every single time someone has a diagnosis of itis, specifically tendinitis, that disease process and that dysfunction in that system has been at play way long before you actually have symptoms, okay? Your body is remarkable at trying to figure out things that are maybe problematic and fix them without you knowing them. The problem with that is that oftentimes our fixing them, we start changing a movement pattern, we start cutting corners, we start adjusting the way we move, the way we hold ourselves and different postures and stuff. And that further contributes to the problem, okay? And I wanna say that because just sometimes it feels like this thing popped up overnight does not mean that it's gonna go away overnight, okay? The other thing that I like to tell patients about is that you know, this is very generalized, but for the most part, if you have some pain, so say you're a runner and you started having knee pain, if you go out, this is always how I like to sort of classify, is this something that's inflammatory related, or is this something that is more myofascial trigger point, muscle tension related? Both of those things actually play into each other, but just for the sake of ease, I will tell that patient, okay, here's what I want you to do. The next few times that you go running, I want you to tell me, is your pain the most in the first 5 to 10 minutes when you start moving after you've been stagnant and cold? But as your body warms up and your tissue warms up, your pain goes away. You feel great, you can go. So once you get past that 5 or 10 minute mark, you're flying. That is inflammation, okay? And the reason that happens is because when our circulation starts moving, because our muscles are pumping and our body is warming up and we're getting more activity and more, anabolic and catabolic activity going, that circulation kind of flushes out some of that gunky inflammation that's been sitting in the tissue at rest, and you actually feel really good and feel better, okay? On the flip side is if you are going out for a run and the first 5-10 minutes you feel pretty good, and then you hit a point where something doesn't feel right. I'm starting to get more pain, in the knee specifically for this example. That's gonna be more indicative of a trigger point or a myofascial restriction in the muscles that once those muscles hit a fatigue point, they're going to stop functioning well for you and you're going to start having more dysfunctional movements and that's going to hurt more. Now, if I have clinicians listening to this, okay, this is a very generalized thing. I'm not an idiot. This is just an easy way for a patient to conceptualize do I have more of an inflammatory type of problem? Do I have more of a myofascial problem? And I will say that as we kind of get a little bit further into this video, when you truly have an inflammatory problem, it's not just the tendon, okay? So what a tendon is a group of connective tissue that has more collagen, but also has some elastin, and it attaches a muscle to a bone, okay? So A tendon does not get inflamed for no reason, okay? A tendon gets inflamed when the muscles who are operating and attaching into that tendon are too tight, they have myofascial trigger points, they're overworked, they've been working too hard, and that creates an aberrant tension through the myofascial and the musculotendinous, connective tissue that creates too much force where the tendon attaches to the bone and starts to create an inflammatory process, okay? So there's also, you can have tendinitis where the tendon itself attaches to the bone. You can also have tendinitis at the musculotendinous junction, which happens as well. So where the muscle tissue itself starts to become a little bit more of the collagen connective tissue that forms into the tendon. But I will say, sorry about peaches. The most important thing is when I'm treating a patient who's sitting in front of me and they're sitting here saying, here's where my pain is, I'm not going to come in and say, well, that's where your pain is, but that's not where it's coming from. No, I am going to validate that, yes, okay, and I'm going to go ahead and get my GAM out for you. And this right here is Osgood Schlatters, just a little side note. So what I'm going to do is I'm going to get a little pokey around that tendon, and they're going to jump off the table and be like, yes, that is exactly my pain, okay? When you have a tendinitis, bursitis, fasciitis, one super helpful manual therapy technique is just simply a cross-friction massage, okay? So I'm strumming back and forth across the tendon. You can also strum right where the tendon. So what's interesting about the quad tendon or the patellar tendon is that your quadriceps muscle, which is 4 muscles that kind of come together, then that tendon basically envelops the patella or the kneecap, okay? So that's supporting the kneecap. So you're going to have potentially tenderness where at the top of the kneecap, right at the bottom pole of the kneecap, but also in this little tendinous area where that tendon then attaches into the tibia. So lots of different areas where we can do cross-friction massage. And cross-friction massage is very comparable to what I described when you start running and it's a little stiff and achy at first, and then once you warm up the tissue, it feels great. When you start doing cross-friction massage here for arguably 30 seconds to 2 minutes, the first little bit is going to feel terrible, okay? It's like, why are you doing this? You're torturing me, stop. And then once that tissue warms up enough, and we got some mechanotransduction, that's a fancy word, I just made it up. No, I didn't make it up. When we've got some heat generated in this area, again, we're going to start flushing out some of that inflammation, and it's going to start to feel better, okay? Try this on yourself. You will get there. Generally at about the 2-minute mark, people they'll kind of like, and I'm like, hey, does that feel better? And they're like, did you stop grinding in there? No, I didn't. Basically, your tissue flushed that stuff out, okay? So I'm going to honor the fact that there is actually something here that we can treat, and almost immediately we can get some productive response. But if I do cross-friction massage and I even do a little tape, or I recommend your little patella tendon strap, we have not addressed the core issue as to why this tendon got inflamed in the first place. And that is the muscles who attach and become that tendon, okay? So that manual therapy technique is necessary. It's super beneficial. Patients can do that if they can tolerate torturing themselves a little bit. Then we're going to look at, okay, what can I do with this quadriceps? Well, I've done some videos, and I would love for you, if you like the content that I'm putting out, follow me on Instagram at spread the well, so spread.the.well, all lowercase. And I have some other videos about stretching. I am not a big proponent, I'm not a pusher of stretching. Oftentimes it becomes more problematic if I go straight in and decide, okay, well, because this tissue is too tight and that's why it's pulling, I'm going to start stretching my quad muscle. That is problematic too, because if you start stretching a muscle that's got active trigger points or myofascial restrictions, you are going to do more harm than good, okay? So the next thing that I give the patient, or if I'm working on them, is I start massaging myofascial release, trigger point release through the quad muscle, okay? And what I give them at home is I'll get them on their foam roller, rolling out their quadriceps, and I'll have them kind of scale that quad for trigger points. When they feel that they roll over a spot that, whoo, that's tender, hold pressure on there. Go back to the video that I talked about what a trigger point is and how to do a specific release. So roll till you find a spot, then hold pressure. About 30 seconds, let it kind of release. Roll, find another spot, and keep kind of doing that, okay? Another thing you can do is any of the percussion guns, Theragun, Hypervolt, any of those things, massage, all of those things are good. If you are someone who likes to stretch, then after doing that sort of thing, you can get a good, decent stretch out of it, okay? Is that it? Do I then let these people go back into the wild and go back to their running and doing things? No, because then the problem originally generally started because some insufficiency of that muscle. So that muscle, we were requiring that muscle to do something that it was not prepared for, or it was not strong enough to be able to do, okay? The next thing with a tendinitis, okay, so we've got cross-friction massage right on the tendon to flush out some of that gunky inflammation. We've got myofascial and trigger point releases to the muscle that attaches and becomes that tendon to get that freed up and create a little space in the system. And finally, we have eccentric muscle contraction, okay? So there's lots of different ways that we can contract a muscle. And for ease, I'll show you the biceps. Look at these guns, huh? I have a coworker I used to work with who's British. He's so lovely. And he would say, "Ladies, which way is the vet? Because these swans are sick." It's just so delightful. Anyway, back to it. Okay, so we can contract a muscle by shortening that muscle. So I'm taking the two endpoints of its attachment and I'm bringing them close together. That is a concentric contraction. I can contract this muscle with no movement of the muscle. That's an isometric contraction, or an isokinetic, and isokinetic. Anyway, table isokinetic for another time. So I can just put a weight here and hold that and not get any movement. The other thing is I can do a lengthening contraction of that muscle where the fibers are lengthening as it's contracting. So if I had a weight in my hand and I could slowly lower it, that biceps is actually lengthening, but I'm still contracting, okay? So kind of start, changing your mindset and the narrative. We have sort of an assumption, if you're not in the fitness world or if you're not in the body working world, that, muscle contraction is just its shortening. Well, we can do both. And so when we're training and rehabilitating a post tendinitis, we want to stick with eccentric contractions. So when we look at what that looks like for the quad, a few different things. One is squatting. So a slow lowering of a squat, okay, is a really good activity, okay? So you still have to squat, come back up, which is a concentric. So when we're contracting and shortening that quad, that's good. But that deeper squatting where we bend our hips and bend our knees, we get into that eccentric component. Another thing is a step down, a slow lowering step down, which I could probably show you here. Hang on. I'll show you with my trusty trampoline. Okay. So another thing is if concentric is me contracting my quad and straightening my knee, then eccentric would be slowly lowering and bending my knee. So I can do like a step down activity, and you see how I'm kind of slowly lowering and then I'm coming back up. So that's a concentric, and this is eccentric, okay? If you are doing this, I want you in front of a mirror because I do not want that knee bowing in, okay? I want it staying straight ahead in front of you, okay? So that's concentric activities. There's lots of different things. I can get into that in another video, but cross-friction massage, trigger point myofascial release to those muscles, and then eccentric conditioning of those muscles, all right? Tendinitis 101. Peace.